in 5, 4, 3, 2, 1.
Good evening, Happy New Year, and welcome to the first meeting of the Customer Corporate Services and Scrutiny Management Committee of 2021. I hope that 2021 proves to be a somewhat less fraught year than 2020 was, but it doesn't seem to be any let up so far, so we'll just have to hold tight and see how we get on. Before we get going properly this evening, I just wanted to congratulate Councillor Rowley, who's been honoured in this year's New Year's honours for his sort of many years of voluntary public service. So on behalf of the committee, I'd just like to say our congratulations for that as well. And then moving us on to the meeting, I think you're all very familiar now with how these meetings work, but just on the off chance that somebody's watching this evening who hasn't watched one of these meetings before, the way that it works is I'm asking all the participants to remain on mute throughout the meeting unless they're invited to speak. They say that they want to speak by raising the blue hand within Zoom, which is visible to me as the chair, and I'll bring them in the order that they've asked to speak, unless they're wanting to make a supplementary point on the issue that's being discussed at that moment, in which case I've asked them just to wave a physical hand, and if I can, I'll be bringing them in just to add any extra points there. Now, these meetings are webcast and they're recorded for posterity, so you know, I hope that all councillors will be on their best behaviour as always, and I think it's always just worth keeping that in mind when we're getting into these discussions. Sometimes it feels very much like we're in these familiar private meetings, but actually there is vast numbers of people out there watching what we have to say, I'm sure. We're going to be joined this evening throughout the meeting by Janie Berry, who's the Director of Governance and the Council's Monitoring Officer, and Dawn Steele, who's the Head of Civic and Democratic Services. They, along with the committee members, will be on screen throughout. But we will be being joined at various points of the meeting by other members and officers who will be taking part in the meeting. So as we reach the appropriate points of the agenda, I'll be inviting them to switch on their video screens and they'll become visible to you. I'm hoping to take a short adjournment at an appropriate stage around the hour mark if it looks like we're going to need one. Depending on how the meeting goes, though, it may be a case of just steaming on through this evening, so we'll slightly play that one by ear. In terms of apologies, I've not received any apologies for the day's meetings, so on to the specific items of the agenda. Item 1 is declarations of interest. So does anybody have anything they wish to declare in respect to this evening's meeting? Not seeing anybody, so I'll move us on to agenda item 2, which is the minutes. Now, we obviously had a very busy November and December, so we've actually got 3 sets of minutes that we need to look through and approve this evening. So I'll just take each one in turn. So on the 18th of November, we had the meeting to discuss the strategic partnership agreement. I just had one correction that I wanted to make, which is just on page 2 on the first paragraph after the bullet points. The 4th line down, it says, such as a commitment to staff being paid the minimum wage, which of course is law. And I think what we were discussing was paying staff the real living wage. So if that could just be amended to that, that would be great. I didn't have any further corrections. So unless any of the committee members did, Councillor Pearson.
Thank you, Chair. It was just the minutes for the 7th of December.
Oh, I was going to take each one in turn.
Oh, sorry.
So if you don't mind hanging on and we'll just do each one.
I do apologise.
No probs. So if everybody's happy that I signed the 18th of November minutes, if you could just give me a wave to show me that you're happy. Fab. Then moving on to the 23rd of November. I didn't have any corrections, but I just wanted to ask either Dawn or Janie, just at the end on page 7, points 4 and 5, we'd made a request that ward members were reminded to let the asset management team know of any particular needs within their wards, and that the revised asset management plan be provided to all members for ease of access. And I just wanted to check whether that had happened yet, or if it hadn't, if we knew when it would happen.
Shall I take that? Not to my knowledge, Chair. Yeah. In terms of it having been provided yet, that would be a question of as linking up with Tracy, basically, to make sure that it's re-provided.
Great. Well, if we just make sure that doesn't slip off the radar, that'd be great. But otherwise, unless anybody else has any further comments, if you could just show me with a quick wave of a hand if you're all happy for me to sign those minutes. Fab. That looks like everybody. And then moving us on to the 7th of December. I had something, but Councillor Pearson, if you want to tell me what it was you were wanting to amend.
Thanks, Chair. So it was just on page 13 that I had noted my particular preference for option 3, which was contrary to the rest of the committee, but it's not noted anywhere in there.
Well, I'd be happy to, if those minutes could just be amended in that way, if that's appropriate. Done.
Thank you.
What I would say is normally we would do that, Councillor Pearson, if you'd specifically asked us to record it, because otherwise it's about the majority decision, as it were, and not individually what each member indicated they would prefer to vote for. So if you specifically want to ask in future, then we can do that, through ask for, you just need to ask that it be recorded that.
Okie dokie. Fair enough.
Preference for option 3. Would you like us to do that in a particular case?
Yeah, I personally was in favour of option 3, but I think that was.
To record that.
Yes, please. Yeah, thank you.
Yeah, I'm happy to do that if unless I'm not seeing anybody else with any particular concern about that. So the couple of things that I just wanted to note, just for accuracy, page 11, right down at the bottom, on recommendation 1, it talks about the school's grant, but actually I think we were talking specifically around the SEN funding. So it was part of the dedicated schools grant, but it was specifically around SEN. So if we could just tweak the wording there just to reflect that. On page 12, the sort of second paragraph, kind of main substantive paragraph in the middle, it says,
Chair,
yep.
Sorry, Chair, just a point of clarification. Just if we are amending that, it's actually SEND, just SEN. The actual proper phrase is SEND.
Sure. Yeah, happy to take it in that way. Yeah. Page 12, then, second paragraph down. In the middle of the paragraph, it says, at this point, some members pointed referenced the motion carried at council. So I think there's either a word missing or an extra word in there. I think we know what that's meant to say, but if we could just tweak that. And then again, just a final, just for clarification, page 13, 1, 2, 3, fourth paragraph. It says, at this point, the meeting went into exempt session as agreed under minute number. It should read minute number 55. Otherwise, if everybody, unless there's any other tweaks or changes, if you could all just give me a wave, show me that you're happy for me to sign all of those minutes. Fab. Right, we'll get those signed then. And take us on to agenda item 3, which is public participation, but we don't have anybody registered to speak this evening, so we can skip that and go straight on to agenda item 4, which is the public health update. So if I can ask Sharon Stoltz as Director of Public Health to join us, and I've also invited Maxine Squire, who's the Assistant Director of Education, to join us this evening, given the somewhat turbulent, shall we say, goings on within schools and education at the moment. So I thought it would be helpful to have Maxine available. So what I've asked is, you should have all received an advance copy of the presentation that Sharon's going to now give us and speak to. I've asked then Maxine, just at the end of that presentation, just to give us a very brief update. She's just been at the York Schools and Academies Board. It's obviously a very fast-moving picture, so if you can just give us the very latest, hot off the press, where we are at the moment, and then I'll invite members to ask questions, both on Sharon's substantive report, and then if there are any additional questions around the schools and that aspect. But as I say, it is specifically a public health update that we're receiving this evening, and so we just need to tread a fine line between not going too far into too much education stuff, but I'm sure we can manage that. So I'll hand over to Sharon to give your presentation.
Okay, thank you, Chair. Good evening, everyone. Robert is going to act as my technical assistant this evening. So thank you very much, Robert, in terms of the presentation. So on to the next slide, please, Robert. Is there one just before that? An introductory slide? If not, no worries. It's possible that that slide wasn't included. So I thought there was going to be an introduction slide here that was just set out what I was going to cover this evening, and that's to give you a quick overview of where we are with the data. Together with some verbal updates of where we've had more new information today, which is updated since the presentation was prepared. To then go into a little bit more detail about what the key issues are that we're working with in terms of the pandemic at the moment, which will include what's happening with schools at the moment, as you've already referenced, Chair. And then I want to hopefully give some time for questions at the end. So on to the next slide, please, Robert. So there are some charts in further future slides that show you these figures, but just to give you a bit of an overview, really, up until about 3 weeks ago, York had one of the lowest rates of COVID, and in fact, if I'd shown you the graph of where all of the local authorities in the Yorkshire and Humber region were, York was at the bottom of that list. That situation has changed very quickly, and York is now is the local authority with the highest rate of COVID infection. There were indications in the run-up to Christmas that our case rates were rising, but we've had a very rapid change over the Christmas and New Year period. So our validated rate at the moment, which takes us up to the 29th of December, as you can see there, is 380.8. But our provisional rate, which takes us up to the 1st of January, is considerably higher than that. And that provisional rate may yet increase because there may be new cases added. So that just gives you some indication there of how quickly this is changing over days at the moment. We are now way above the regional average and getting quite close to the national average now. So going on to the next slide, please, which should be a graph showing what that are. Right, okay, I just went through this one. It was just in the wrong order. So on to the next one, please, Robert. So this graph kind of shows really what's happening here. So the red line is York, and the green dotted line is the region, which is Yorkshire and Humber, and then the black dotted line is the England average. As you can see, we had a spike in cases in October time. We went into the old tier 2 at that time. That was not wholly down to students arriving in the city, but the student cases had quite a significant impact on that, because those outbreaks were quite contained. We were able to, as you can see on the graph, get a grip of those outbreaks very, very quickly. And bring our case rate down, and it stayed down for quite some weeks. But as you can see, it's now rapidly increased, and you can see how our trend is now bucking the regional one and is kind of following the national trend there, which just confirms what the figures said in the previous slide. So going on to the next slide, please, Robert. And this just confirms what I just explained, that you can see there with York as the red bar that we are now significantly higher than all of the other local authorities, our closest neighbour being Doncaster, but there is a there is a big difference there. So going on to the next slide, please, Robert. So this shows our 7-day incidence rates, and this slide shows what's happening with residents aged over 60. We're particularly concerned about residents over 60 because we know they often have underlying health conditions that can mean that they can get sicker if they are unfortunate enough to get COVID and may need hospital admission. And we know this is one of the indicators that national government looks at as well. So as you can see, our rate in York, the red line again in over 60s, is shooting up. And we're very close to the England average now on this, with a rate of 254.2. So that is something that is a concern for us, and something that we're keeping a very close eye on at the moment. So on to the next slide, please. This shows what's happening with our positivity rate. Back one, please, Robert. Lovely, thank you. So this shows what's happening with our positivity rate. So looking again at the red line, what you can see is that our positivity rate was very high. It was significantly higher than both the regional and national averages. As I mentioned earlier, in kind of October time, we managed to get that down. Our positivity rate has stayed much lower than regional and national averages over recent weeks, but now increasing, which again is a real concern for us. So on to the next slide, please, which shows hospital activity. Want to say a little bit about this because this data is considerably out of date. So this is looking at the 23rd of December. So the latest information today is that on the York Hospital site, they have a total of 70 COVID-related patients at the moment. So that means that they're almost to the peak that we saw earlier in the year in the spring. But I would also add that the hospital is also seeing an increase in usual winter-related activity. So they're not just dealing with COVID. With the weather having turned much colder, they're seeing a significant increase in non-COVID patients presenting at A&E and also needing to be admitted to hospital. So the hospital is coping at the moment. It has its surge plans in place, and they are coping, but they're under a great deal of pressure at the moment. And if the hospital is under pressure, that also leads to additional pressure on adult social care. So the hospital, our adult social care and community colleagues are working very closely together at the moment on discharge plans. The difficulties that they're having is staff resource, and particularly in domiciliary care for packages of care to support people, because as levels of COVID increase in the community, we also start to see the impact on staff, either with COVID themselves or having to self-isolate. So the system is running quite hot at the moment. The system's coping, but it is under a lot of pressure. So obviously something that we're keeping a very close eye on. So on to the next slide, please, which looks at excess deaths. So colleagues will be very familiar with this picture. picture because we've looked at this before, where we saw that spike in excess deaths earlier in the year. Since then, the number of excess deaths has reduced as we've seen the number of COVID deaths go down. We're now starting to see more COVID deaths come through. So we've had 39 COVID-related deaths over the last 11 weeks. But still, good news, we're not seeing the peak of deaths that we had earlier in the year. And that's really because clinicians understand the nature of the disease a lot better. There are different treatments in place, so people are surviving. What that does mean, though, is that often they're in hospital for longer, and they may need additional support from adult social care when they come out. So great news that we're not seeing the same number of deaths, but that's partly what's causing the additional pressure across the system. So on to the next slide, please, which shows what's happening in terms of age groups. And if we go on to the next slide, please, Robert, there's a graph that shows you this. So as you can see, these are all York numbers in age bands. We can see an increase in cases across all age groups. Largest rise there is in the 35 to 49 age group, but as you can see, every age group has been increasing. Just a bit of a leveling off with the 0 to 14s. That's just because of the Christmas holiday, but I can tell you based on our local data that when this chart is updated, we will have seen an increase in school-aged children as well, with the updated information coming through. So on to the next slide then, it just gives a little bit of information about what's happening in care homes and schools. So as at the 31st of December, as you can see there were 7 care homes in the CYC area with confirmed COVID infection. Because we're doing regular testing, weekly testing of staff and monthly testing of residents, quite a lot of the cases that we're now seeing are asymptomatic. It's a number of the cases we're picking up are in staff who've been exposed to infection outside of work, not within work. We also have very robust, tried and tested processes in place to respond very quickly to any cases in a care home. So the last outbreak that you can see there was on Christmas Eve, and even over Christmas period, we had staff and services in place to be able to go in and support those care homes. And I'm not aware, based on the current data, that we've had any further outbreaks. In terms of schools, this really talks about the picture up to before schools went on holiday. The numbers of children have increased since then, and we'll talk about that a little more with Maxine later on, so I won't say any more about that here. If we go on to the next slide then, please, Robert, watch this shows us, and this is today's data, so bang up to date. We can see what's happening in different areas of York. If I had a graph to show you here, or a map rather, you'd be able to see that we've got deep purple splodges now on the map across York, which shows where we have very high case numbers. And I can circulate that map to members of the committee after the meeting, Chair, if that would be helpful. What you can see here is how quickly this is changing. So last week, when we were looking at this data, the area that had the highest number of community outbreaks was Bishopthorpe. This is the Bishopthorpe and Cotmanthorpe MSOA, but we know it was Bishopthorpe and Askham Richard that were the two villages that were seeing the majority of community outbreaks. And we responded very quickly with the North Yorkshire Local Resilience Forum to mobilise a local testing site in Bishopthorpe that has went on site today. It's going to be there for a week until next Monday. And we've organised for residents of Askham Richard to be able to present to the Poppleton Bar Park and Ride site, even if they don't have symptoms of COVID, so that we can form a view as to what's happening in that community. This morning, based on yesterday's data, we were aware that Woodthorpe and Acomb Park had overtaken Bishopthorpe and Askham Richard as areas of concern. So we've been having discussions today with LRF colleagues and the military about mobilising a local testing site there. But as you can see, even through today, that information has changed, and you can see that we now have very high numbers across lots of areas of York. So that's just to kind of illustrate how quickly the situation is changing at the moment. And then on to the next slide, which just says something about local contact tracing. Obviously, because we're seeing an increased number of cases, positive cases, the number of people being referred into our local contact tracing service is increasing. We're busy. I've been having discussions today about scaling up our contact tracing service to be able to cope with the increased activity. And then going on to the next slide, there's a graph that just kind of shows you where we are. A bit of a time lag with this, actually. It only goes up to the 31st of December, so those numbers will have increased again when this is updated. And then on to the next slide. I've just picked out a couple of key issues here. But I'm conscious that members may have other issues you want to raise as questions. But just to kind of summarise the key issues, as we've seen throughout the data presentation, we're seeing a significant rise in infection rates across York. That is having an impact on services. I've talked about the NHS and adult social care, but we're also seeing an impact on council services as well. So we have some council teams that have been quite significantly impacted with COVID, with a number of staff needing to self-isolate. So, for example, our highways team is one of the areas, one of the teams that's been impacted, and we'll be starting to see increased levels of staff sickness due to COVID, which we're managing as a council. We have plans in place to be able to respond to the demand, but it's just recognising really that as the needs of the city have increased, we have fewer staff to be able to respond to those needs. So that's putting pressure on everyone at the moment. Even though we've increased testing capacity, we are still struggling to meet demand. So we have one lateral flow testing site operational at the moment, which is York St John. That is fully booked. So anybody who tries to book an appointment won't be able to, and there are no free appointments up until mid-January on that site. That's kind of just represents the demand. We will be opening another site in partnership with the University of York from next week that we had originally intended to dedicate to schools testing. We're expecting the Prime Minister to make an announcement later this evening around that, so we don't know what they're going to say about schools. But obviously, if there's a change in policy on schools, and we don't need to dedicate that site for schools testing, then that will give us increased capacity for residents. I've mentioned the local testing site we now have operational at Bishopthorpe, and we're having discussions around Woodthorpe and Acombe Park at the moment as well. The issue is not funding around testing capacity. The issue is finding the staff resource to be able to do the swabbing and the contact tracing. We are working as quickly as we can to increase that staff resource, but obviously we have to find the staff, we have to recruit them and train them. So we're moving as fast as we can on that to try and meet demand, but obviously that's going to be a little bit of a challenge for us in managing residents' expectations and demand for testing and until we're able to get that increased capacity in place. Loads of work going on around communications and engagement, and I'd welcome, Chair, any feedback from members of the committee around how we might improve that through members' networks. And then we said that we would, Maxine would give an update on schools. So those are the key issues, Chair. And then the final slide is just questions. So I think you can take that presentation down now, Robert, if you could. Thank you.
Thank you very much, Sharon. That was really quite sobering, I must say. Very comprehensive, but you know, I think yeah, that's sobering is the only word that comes to mind. There's an awful lot of information there and an awful lot of figures that are pointing in the wrong direction, I think. What I'll do, I note that Councillor Rowley's got his hand up for a question already, as is often the case. But what I'll do is I'll just invite Maxine to give us an update on where we are with schools, and if members could just make a note of any questions that they had for Sharon, and then we'll open it up to questions for everybody.
Okay, so just to first of all reiterate that one of the features of the work during the pandemic has been the very close working between education and public health. So the work that we've done through the York Schools and Academies Board has always followed public health advice, and we've been very fortunate in having a member of the public health team in those meetings, and that's continuing. The main emphasis of meetings over the Christmas period have been about the introduction of school testing on the secondary school sites. Again, as a city, we've worked very collaboratively as a school community and public health to get those arrangements in place and stand them up very quickly. A testament to the success has been the amount of traffic through the testing centres over the weekend, because we opened up that opportunity for people to begin to get their children tested in the exam year groups. Sharon's team put that testing out there very, very quickly, and it's been a victim of its own success, really. We've seen heavy pressure on the testing sites over the weekend, as I say. As of today, we've had 3 primary schools that haven't been able to open. One of those has taken today as an additional training day, just to give themselves more time to assess their staffing capacity, but it's looking likely that they will be partially open tomorrow, and that's Huntington Primary Academy. Copmanthorpe Primary, that was a full closure other than for key workers and vulnerables today, as was Knavesmire Primary Academy. That wasn't due to staffing not being available due to staff having COVID. It was actually due to some of the action taken by the NEU around invoking Section 44 of the Employment Act, and they'd encouraged members to actually contact their schools to express their concerns about the safety of working on school sites and the challenges around the full opening of schools. Tomorrow we'd be notified that Yearsley Grove and St Paul's Primary and Carr Infants would also be in a position where they were not able to have sufficient staff in to be fully open, so they also would just be open to key workers and vulnerables. That's pending any announcement this evening, obviously. We've had some partial closures today at Dunnington Primary School, which has just been open to reception in Year 3. But across the board, out of our 50 primary schools, that's actually quite a healthy picture in terms of schools being open. Our secondary schools were only going to be open this week to key workers and vulnerables, and then gradually would open to the exam year groups, Year 11 and Year 13, from next Monday, with all secondary pupils being back from the 18th of January. But as I say, we're pending that announcement this evening to see if there's going to be any changes to that. The secondary schools have been receiving their lateral flow testing kits today from the Department for Education, and they have all received those kits. But again, it's the close working with the public health teams that are helping with developing their plans around the on-site, on-school sites being used to test contacts. We've done an awful lot of work together around how we can stand that up. As Sharon says, the main issue has been about sourcing sufficient people to support the testing. YSAB today are going to assist with that by pointing any volunteers in the direction of the public health teams. So there's been an agreement from the head teachers and chief executives in YSAB where they've had people coming forward to volunteer to support testing from the community, that we will be signposting them towards the public health efforts. So I'll leave it there and then open it up to any specific questions.
Thank you very much. Just before I go to questions, just a point of clarity on the closures that we've had so far. Notwithstanding obviously anything that may or may not be said later on today, is your understanding that those schools that haven't been able to open will continue to not be able to open over the next few days, or are there contingencies in place? What's the ongoing picture likely to be?
Yeah,
notwithstanding.
Yeah, what the schools are doing obviously is they're responding to the concerns that staff have raised about why they feel that the environment is unsafe. Again, colleagues in public health have clarified for schools how to update their risk assessments, and it is about reinforcing the successful measures that they've had in place throughout the pandemic. So the control measures that schools have are the right controls, both for the new variants that we've seen, as well as their original response to COVID. So public health colleagues are very confident that schools are operating the right measures. It's now about responding to individual staff, and we have had some staff change their view today about going back into school. So it's head teachers working with members of staff through their individual risk assessments over the next few days, just to review on a daily basis what their staffing capacity is looking like. And yeah, as I say, we're going to see a different picture as we go through the week. So it's a daily review that's taking place in those schools.
Thank you. That's helpful. And apologies, committee members. I'm just going to use my privilege just to ask a follow-up question, which seems to me the obvious next question in a way, which is, what conversation and discussions have been had? Obviously, some councils around the country have made calls on either to the minister directly or have made unilateral decisions to advise their schools not to reopen. What's been the picture in York? What's the discussion been around that, and what's the current thinking in terms of, as I say, we're slightly speaking with an elephant in the room of anything that may or may not be coming up, but if you could just give us a sense of where those conversations have been at, I think that would be helpful.
Yeah, what we've always said throughout the pandemic is that we would follow Sharon's lead as Director of Public Health within our work with schools, and so Sharon and Amanda as Director of Children's Services have given that very, very clear lead about where they feel the data is pointing to in terms of, are our schools safe to open? Sharon and Amanda issued a statement this morning for parents and staff in schools to say why they were confident that the control measures in schools were the right ones, and that primary schools in the city were safe to open today. There is no provision for us to close schools under the COVID Act. I don't know whether you want to add to that, Sharon, that neither the Director of Children's Services nor the Director of Public Health can unilaterally close schools.
That's right. So if, for example, I felt that the public health risk, either to staff or to pupils, was great enough in a school, and that we'd got to the point where I felt that the control measures in place were no longer adequate or no longer working, it would be a discussion that we would have locally between Amanda Hatton, myself, the school, the head teacher, school governors, etc., as to whether we felt that the school needed to close. Amanda and I would then have to speak to Public Health England and the Department of Education to justify our recommendation that a school closed on public health grounds. But the actual decision would have to be made by the minister. But at the moment, as Maxine has described, we've had lots of detailed discussions about this over the last few days. And even though case numbers have gone up, as we've seen, I am confident that the control measures that schools have had in place throughout the pandemic are still effective. And so what we've asked them to do, as Maxine has said, is to update their COVID risk assessments. We've asked schools to listen to their staff who have expressed concerns on health and safety grounds, so that we're able to try and address those, if necessary, on a case-by-case basis, because we want our children to be in school and we want teachers to feel safe to be in school and to teach children. So we've taken a very proactive approach, which I understand is different to the approach that some other local authorities have taken, but I believe it is the right approach for us in York.
And we are continuing our weekly meetings between the York Schools and Academies Board and the professional associations, both the teaching unions and the non-teaching unions in the city, and that's a very healthy dialogue that's taking place on a weekly basis.
Thank you both. That's really helpful. Thank you. So, Councillor Rowley, you just dropped out, and I think you missed some of the response from Sharon there. But I'll bring you in because you were first in with your hand up for the question, which I think was on Sharon's earlier presentation.
Yeah, thank you, Chair. Chair, I actually have a question. One question for both, if that's okay.
That's fine.
If I might ask Sharon first. Sharon, this becomes no less sincere with repetition, but thank you so much for what you and your team are doing under really difficult, trying circumstances. And thank you so much for the information that you shared with us, and also for allowing us in a very difficult time for you to have sight of that earlier this evening. That was really helpful, so thank you for that. My question to you, quite simply, is this: there's nothing in there about COVID reinfections. Do we have any data about how many people are being reinfected with COVID who may have had the infection in the spring last year?
No, we don't. And I'm not aware that that information is readily available nationally either. We know that there have been cases worldwide about people becoming reinfected. The World Public Health community is working together on that. So there's information being shared across countries to try and have a better understanding, not only of, can you be reinfected after COVID? If you've had COVID, does that mean you're immune to the new variant of the virus? So though there's lots of research going on around that. The belief is that theoretically it is possible to be reinfected with COVID because we don't quite know how long immunity lasts. But other than that, there isn't any more specific information than that. And I don't have any figures for York. No, sorry.
Thank you, Sharon. And Chair, if I might just ask Maxine my question, and then
yeah.
I will mute for the rest of this particular discussion. Maxine, again, my thanks to you and your team for what you do. Obviously, I've been involved in governing schools for a long time, and I know what you do. The question I have for you really is that Archbishop Holgate School, where I am a governor, have insisted that where the children don't go back physically, that they do continue their schooling through Google Classrooms. In fact, there's a regime that's been insisted upon that pupils actually log in to Google Classrooms from home at the start of the school day to work through their school programme. Whilst I know that's happening at Archbishop Holgate School, is that happening across the city? And just really an update on where we are with that.
Obviously all schools are using different platforms to support their virtual learning. Google Classrooms is by far the most popular one that's being used out there at the moment, but it does vary school by school and trust by trust. All our schools have got a remote learning offer in place now. And they back it up with paper materials as well, where they know there are connectivity issues, or they know that, for example, within a family, they might be sharing more than one laptop, for example. And some parents actually express a preference to actually have some physical materials as well as the online. So one of the things that we've been doing throughout is networking the school community so they can share resources. And again, it's been a really strong feature of the work that's gone on both in the Maintained School Heads meetings and also in the York Schools and Academies Board, the way that they have been very willing to share their good ideas across the system, and also share resources where people have been struggling with resources. There's still, as I say, we're still pressing as a community on the issues with the DFE around ensuring that there are enough devices, that there's enough access to fast broadband for people, and that the connectivity issues are there, because we know that's both a national issue and we've got pockets of that in the city as well. But our schools have really moved mountains in terms of the way in which they've put the offer out there, and certainly they're ready again to switch that on, whatever the announcement is tonight. Obviously, all our head teachers though would prefer to have children in their schools, and that's still their position.
Thank you, Maxine. So I'm just going to take everybody's questions in the order that their hands have gone up. So first up is Councillor Mason.
Thank you. One for you, Sharon. I just wondered how we're using lateral flow testing within the council to keep staff either in work quickly or for contact testing to keep them at work for kind of key services.
So this is something that we thinking about piloting in Neil Ferris's area. So I mentioned earlier, I don't know whether you want to come in at this point, Neil, some of the pressures in Neil's team, particularly in James Gilchrist's area. And so what we're interested in doing is working slightly outside national guidance for lateral flow tests, and pilot doing a test and release service system with our staff. Now, the government has done small scale pilots on this at the moment. The one that you're all most familiar with is school testing, where, you know, you'll be aware of this, Councillor Mason, about, you know, the government's plan to use lateral flow testing to be able to test children on a daily basis and release them to be able to attend school if they test negative. We are going to pilot this now within the council in Neil's area, and Fiona Phillips and James Gilchrist, as two, you know, the two assistant directors, have been working together this afternoon on how we're going to introduce this, hopefully from tomorrow, as a pilot program to see how that works. If it works well, then perhaps we might want to look at introducing that across other council services that we know are under enormous pressure. But Neil may want to say a little bit more about that, Chair, if that's okay.
Yeah, that's absolutely fine. I'm just going to quickly note that Councillor Rowley has switched off his video just because he's having a bit of connectivity issues. So he is still here in the background, but not visible publicly. Neil, I'll just introduce you as the Corporate Director for Economy in Place. And if you want to just very briefly give us a little update on that, but I don't want to go too far into this if we can.
No, absolutely. Just it's the comment really about staff and as numbers are rising in the community, they're clearly rising in their staff cohort, and self-isolation again is an important part of the response of staff to ensure that we don't get a spread more widely. But just as the community figures have risen dramatically, they're rising dramatically within our workforce, and in particular that impacts us as a council in those services that continue to be delivered out there on the front line for the public. So my particular concerns today are highways winter gritting, to make sure that we effectively have a team that is self-isolating in terms of being isolated from the day-to-day workforce, so that they can be available for winter gritting in the evening when obviously that is needed. And from a refuse collection perspective, again, we've got a pocket of outbreak within the refuse collection service, and making sure that we've got the appropriate number of supervisors and staff to deliver that. It's fair to say that both services are incredibly stretched this morning, and obviously as we go through this week and we get the fallout from Christmas social commingling, we might even see those that bit further. So the work that we've had undertaken this afternoon between Fiona and James is really welcome, because that gives us the opportunity to manage the period of self-isolating that staff have to take when they come into contact with others, but in such a way that we don't expose the rest of the service to further risk. So we're really grateful for Sharon and the team to pilot this within the waste and highway services.
Thank you.
Thanks, Neil. I think it might be helpful for us as a committee just to hear an update in a month's time on to how that pilot's gone. So I don't know whether that's something that either Sharon you can incorporate when we next see you, or perhaps Neil just to pop back. But I'll pick that up afterwards. But I think that would be something that sounds very interesting and you know, like a really good bit of work. So thanks for that. I'll move us on now to Councillor Fenton.
Thank you, Chair. Just picking up what Sharon was saying earlier about communications and I was wanting feedback on sort of the effectiveness and the range of communications that the council does put out. I think it certainly in my experience over the weekend, in terms of looking at the situation in Woodthorpe and Aiken Park, which has been alluded to, the common question from residents has, I think, firstly was it underpinned some of the concerns about the return to school, in terms of residents wondering, well, has there been a rapid rise in in the area? Is there a link to school attendance? And part of the issue has been, and I'm sure it's likely because the information, the hard data doesn't exist in terms of what are the drivers behind that increase in infection rate, because those are the questions that residents ask, and the line that I know other councillors are saying is, it's up to all of us to adhere to the restrictions and the hand face space, but it's I think residents are kind of wanting to know, because they want to make sure they're not inadvertently doing anything that might be contributing to this. And I suppose it's really a case of, in the communication that the council puts out, if you can tease out some of those messages in terms of that 35 to 49 age group, making it clear, this is a trend we're seeing across all age groups, and it's just trying to make people think about their actions and how they may be contributing to that. So I suppose really a plea for as much granularity as can be provided to reinforce those messages and to try and encourage compliance with the restrictions, which I think, as we all know, may be changing a bit later on, which may make our task easier. But I certainly don't think we can be complacent about that. Thank you.
Thanks, Councillor Fenton. I don't know if you wanted to comment at all on that, Sharon. I suppose kind of contained within that, in a way, was the question that I'd got as well, which was really if you've got a sense of what it is that's driven the significant change in York's position over the last 3 or 4 weeks.
Okay, yeah. Thank you, Councillor Fenton. That's very helpful feedback, and I'll take that back and have a discussion with the communications team about what more we can do. In terms of what's driving the increase, I think it's a combination of factors. Undoubtedly, we know that the new variant of the virus is more contagious. And so we know that it spreads more easily. There's no evidence that it makes anyone sicker, but we know that it spreads more easily. And that new variant has appeared at the same time that perhaps people were excited about Christmas. They were out and about more with Christmas shopping. We just come out of a 4-week national lockdown. We know that the city was busier, pubs and restaurants were busier, people were out and about more. Even though the government changed the Christmas plans to reduce the amount of time households could mix to Christmas Day, they made that announcement quite late. So we know that some families had already travelled to meet up with extended family. So there was more mixing, and also there is some evidence coming out from the National Behavioural Unit that the messages of hope with the vaccine as well, all of that together has led to perhaps people relaxing and letting down their guard, and probably being not as careful about hands, face, space, and not being as rigorous around those infection control measures. It's human nature, isn't it? All of the talk was the vaccine's here and things are going to get better, and it's human nature for people to then relax a little. The message really, therefore, is that if we're going to beat this as a city, because there's a real chance we could find ourselves going into tier 4, not trying to second guess what the Prime Minister will announce later this evening. But if we want to get a grip on this virus, we're going to have to work as a city together again, and we're going to have to do what we did through the spring and summer. And everyone is going to have to work really hard and pull together again, to make sure that we're following the infection control measures. They haven't changed. They work on the new variant in the same way as they worked on the old one. But people need to be even more scrupulous about following those hands, face, space, social distancing. If you have symptoms, booking a test. Once our lateral flow testing is able to take bookings again, we're encouraging people to book a lateral flow test as well. But it really needs a city response and everybody coming back together again. There's no silver bullet, I'm afraid, for this. It's just everybody working together and going back to being very careful about those measures again, until the vaccine becomes more readily available, which for the majority of healthy people may not be for some time yet. Might be some months before healthy people under 50 are able to be vaccinated. So, we're still dependent on those infection control measures.
Thanks, Sharon. I think, I suppose just feeding or picking up on some of Councillor Fenton's point around feedback around messages. I suppose my thought in terms of what I'm hearing from you, my worry in a way is that we get such mixed messages from the government, and so much of the emphasis is put onto individuals to take responsibility and actually, it's sometimes societal changes that we need to see. And I wonder whether or not there's anything that we could do within the messaging from the council to kind of emphasize that point around it's about all of us, and it's not about necessarily just one individual washing their hands more, or even though that is very important, but it's actually around saying let's try to not give mixed messages as a council at the very least about encouraging people into town to the local shops, but at the same time don't go and interact with too many people and that sort of thing. It's a very difficult balance, I do understand that, but I think my view would be that the national picture isn't one to follow, and perhaps we could do something a bit better here in York. Councillor Musson, you were next.
Thanks. I've had quite a few questions written down, but I think some of them have been answered already, so I'll try and clump them together so it's as brief as possible. Potentially for either of you, there are parts of York where the infection rates are higher than other parts of the country, for example, boroughs of London where primary schools are closed. Primary schools are going to be closed in Scotland and Northern Ireland and areas of the south, and schools closed in March of last year when the infection rate was far lower than it is now. I understand that's because we didn't have the current control measures in place. However, I guess my question is something which a lot of people have been asking, which is what makes those decisions wrong and where ours is right to keep the schools open? Not that it's your decision, but our advice that it's perfectly safe when other areas are perhaps making a different call.
Do you want me to start, Maxine, and then you can jump in? I think essentially that's because that's a decision the government has made. So, it was a government decision to close primary schools in the London boroughs. And then when they were lobbied by local authorities who were concerned because they'd been excluded from that, it was the government's decision to extend the number of London boroughs where schools could be closed. And it's a decision that the Scottish Parliament has made around the schools in Scotland. And I think that's really important to recognise that. In York, we've had to make a decision on what we think is right for children in York and what's right for our schools based on all of our local intelligence and our joint work with schools on what we think is safe. Obviously, if I felt as Director of Public Health that our schools were unsafe, as we mentioned earlier, Amanda Hatton and I'm sure the portfolio holders would be lobbying government to say, we want you to make a decision to close York schools. What we have done is ask the government to make its mind up around schools. And we've also asked for the government to delegate those decisions around schools locally, because we think we're better able to make those decisions locally than nationally. So we can lobby, but ultimately the decision is one that the minister makes, and we don't have a great deal of influence over that. I don't know whether you want to add anything, Maxine.
Yeah, there's also obviously the fact that we've had very little evidence of transmission of the virus inside our schools throughout the pandemic. So numbers have been very low. Yes, bubbles have had to close, but it's been about individual cases where then contacts have been identified and a bubble's closed. Asking head teachers this week, they've said that in most cases where bubbles have closed, they've not seen those children from those bubbles actually develop the virus. That's one of the things that it's important to reflect on. The other thing is that throughout the pandemic, from March, attendance at York schools has been significantly higher than national across all groups, which again gives us confidence in some of the measures that schools have put in place, that it has actually been creating a safe environment for children and staff to work in. And they, as I say, throughout, they have rigorously followed the advice from the public health teams about how to create those environments where they're minimising risk. As Sharon has said, we can't eliminate it, but they've been very successful in minimising risk over the period of time that our schools have been open.
Thank you. Councillor Musson, did you have a supplementary to that?
Yeah, I sort of extra a couple. I don't envy being in either of your positions at the moment, particularly given that we are likely to hear another moonwalk backwards on education policy tonight. I guess my question is, the next one is, at what point would you take up the active lobbying that you've just talked about that other authorities have done? How bad would things need to be in York regarding hospital pressures, etc., for you to actually decide, actually, we need to make some sort of case towards the minister for?
So we would have to have evidence of widespread transmission of infection within the school environment. What we know because bear in mind, we do a lot of investigation and dig into these cases. What we know is the majority of cases in children have been through household transmission or mixing outside of school. And as Maxine's just said, when we've investigated this, we haven't seen widespread evidence or much evidence at all, really, of child-to-child transmission within school or child-to-teacher transmission within school. If we saw that situation change and it became clear that the control measures within schools weren't working anymore, and we were seeing transmission within schools, and we could tell that from our contact tracing, then that would be the time that we would change our policy. We wouldn't change the policy based on what's happening with the NHS or what's happening anywhere else, because it's important schools are educated. It would be that change in us feeling confident that we can continue to keep children safe in schools. That would be the change that would need to happen.
And that's been our continual position throughout, that actually schools have to feel confident that they can operate safely. So, you know, sort of, we've always said to head teachers that that's their call on, if they feel that their school for any reason is not able to operate safely, then that's when they should consider closing their school.
Thank you both. I'm very conscious of time, and we've given this a good long chunk of time, but longer than I'd thought that we might do. I think it's been important to. I've got Councillor Kilbane who's been patiently waiting. Councillor Musson, I see your hand gone up again. Did you have a final question that you wanted to put on this as well, or?
Pete, and if there's time, I'll
okay, well, what I'll do, I'll take Councillor Kilbane, and if we could just make a relatively quick, and then if you can have a very quick question at the end as well, then we'll try and get everybody's in. So, Councillor Kilbane.
Oh, thanks, Chair, and thanks, Sharon and Maxine, for all the information and the work that you're doing. I'm trying to think of questions that might still be relevant in 1 hour and 20 minutes. Just in terms of the transmission, I know that on the NHS Test and Trace app, Public Health England were able to narrow down common locations for where transmission was taking place, and I think it was supermarkets and schools were about 40% of those locations. With the test and tracing that the tracking that we're doing in York, do we know where the most common locations of infection occur? I mean, I know it'll be within household, but kind of how does it get into the household? And my last question, honestly, Chair, is where are we in terms of excess deaths? It's the question I always ask. But for this year, for this last year, how many more people died in this last year than in the previous 4? So the 5 year sort of rolling average, really, we up or down, or where are we?
So in answer to the first question, yes, we do know where outbreaks are occurring. We monitor that on a daily basis because it helps us to identify where there are particular outbreaks and where we need to target our resources. And we've done some of that work where we've gone in and done some targeted work with businesses where we can see there's been a number of cases. So we do that. We can also monitor household postcode information, so we can identify where there are clusters in particular postcode areas. So we monitor that very carefully as well, and respond to that. That's obviously becoming more resource intensive as we're getting more cases and more people transferred through, but we do monitor all of that. In terms of your final question then around deaths, overall, even though we've seen a significant number of COVID deaths, we've seen a reduction in deaths from seasonal flu, at least so far. So when we look at the deaths overall, I can't, off the top of my head, have the number of how many excess deaths that we've had this year. I don't have that number to hand, but again, Chair, if it would be helpful, that information could be shared after the meeting and put in the minutes, if that would be helpful.
I think if you could do that, would be great. Yeah. Thank you. Councillor Musson, did you want to ask your final question?
Yes, it was just one more, which is that you said that you've sort of left it up to the heads in making that final call if they were to come to you and say that they have genuine concerns about their school. So I guess my question is, has anyone been in touch with you yet to say, actually, I do have concerns and might want to look into moving to online only? And how are those people being supported? And have you had many, basically?
Obviously, as I've said today, three primary schools have reviewed their staffing levels and felt that they couldn't operate safely. So that was Knavesmire, Cotmanthorpe and Huntington Primary, and they did take the decision that they couldn't have all children in school. And we've also tomorrow got Yearsley Grove and Carr Infants that are in that position. So their governing bodies actually met today. And it's important to recognise, that it is a decision for head teachers and governing bodies primarily to decide on when they feel that it's operationally not right to continue to have all their children in school, and that is determined by their safe operating staffing levels, their staffing ratios. So those decisions have been taken by some schools, as I said earlier in the meeting. What we've always said is that we would support our schools in terms of the fact that they have done their rigorous risk assessments. They know what they need to have in place in order to be able to keep those control measures that have been very successful working to their optimum. So it's important that we support them with their decision making around that, which is what we've been doing.
Thank you very much, Maxine. I think I'm going to wrap this section up here, because we have gone a bit longer than I'd anticipated, but as I said before, I think it has been very worthwhile. So I'd just like to thank Sharon and Maxine both for attending this evening. In particular, Maxine, I know we put you on the spot very last minute today coming, but I think it was really helpful to have you here. Sharon, I'm sure we'll see you again next month, and who knows where we'll be? Who knows where we'll be tomorrow, let alone next month? It does feel a bit like that at the moment, doesn't it? But thank you both. You're both welcome to leave the virtual table now.
Thank you, Chair.
Thank you. What I'll suggest that we do, I make it just before 10 to 7. I'm going to suggest we take a short adjournment now, just to give everybody's chance to stretch the legs and give their eyes a quick rest. So if I can have you back just before 5 to 7, with a view to us starting again at 5 to 7. And apologies to those who are off screen waiting to come to the table. I know you've been waiting a while, but I think if we can just have 5 minutes to refresh ourselves, and then we'll have a more productive second half of the meeting. So see you all back in a few minutes time. If you could just switch off your video screens and follow the instructions. Welcome back, everyone, to this evening's meeting of the Customer and Corporate Services and Scrutiny Management Committee. I'm just going to make a note that Councillor Rowley is with us on screen at the moment, but his connectivity is a little bit dodgy. So I've advised that if he is having trouble, if he just switches off his camera. So if he disappears, he is still here in the meeting and can still contribute, but the watching public may not be able to see him. So we've obviously been discussing public health at some length, and I think it was worth us running a little bit over on that item, but it does mean that we are a little bit behind where we should be. So I'll move us swiftly on to agenda item 5, which is the York Central Partnership governance. So if I could invite the officers and various members that are coming to join us for this evening. We've got Tracy Carter, who's Interim Director of Place, joining us. We're also joined by Neil Ferris, who's the Council's Corporate Director of Economy and Place. And then we also have Stephen Hind from Network Rail, who I believe is Head of Business Development, and Catherine Clayton from the National Railway Museum, who's Assistant Director for Operations and Business Readiness. I hope I've got all your titles correct there. And I believe that, Tracy, you've got a presentation for us to begin with. I'm not sure whether Catherine and Stephen are also contributing to that presentation, but I think you're all available for questions after the presentation. So over to you, Tracy.
Thank you very much, Chair. I'll just get the presentation going. Apologies for my ultra orange Tango product placement camera settings. There's something that happens late at night when it all turns rather orange. So are you all able to see that presentation? No, you can't. Within a second.
We had it there and then it disappeared.
And then it went, yeah. How's that?
We've got the presentation up, but we can see your slides down the side at the moment.
All right. Problems of having two screens. Now, I theoretically know how to do this, but it's not giving me the option to switch over to the other screen. So is it okay if I just carry on with it like that?
Yeah, I think that'll be fine if members are all happy with it. Seeing nods. Yeah, go ahead.
Okay, sorry. So I will be presenting the kind of core of the report to you, and then I'm going to ask Stephen and Catherine to talk to you a little bit at the end of the presentation about the elements of the governance arrangements that relate to their organisation specifically, or the major landowners as part of the York Central Partnership. If I can just proffer the apologies of Marie Cadell, who from Homes England, who was due to also join us today, but due to an emergency COVID related response has had to pull out at the last minute, and I think Stephen Hind is going to speak to us on behalf of both Network Rail and Homes England. So the report sets out the existing governance arrangements, but it also sets out some of the kind of key changes to the that are going on around us that are leading to a review of the existing governance arrangements. So if you can see that slide in front of you setting out the current governance arrangements, what you have there is the strategic board sitting at the top of that diagram, which is all the representatives of the York Central Partnership and a range of external bodies, and that body being chaired by last year by Dame Mary Archer. That is set at a very high strategic level of the most senior representatives of those organisations. But the key work of coordinating the activity of the project is done by the York Central Delivery Coordination Board. And then below that, we have 4 strands of activity referring to the different work streams that contribute towards the different project. And for the council, that means that the executive has a key role as decision maker in all those things that are delivered by the coordination board or by the strategic board. So that's the current arrangements. If I can then just kind of remind you of the funding contributions and the kind of key roles of bodies within the partnership. The infrastructure to open up the site is going to cost in the region of about £155 million, and that is largely met through the recent agreement by MHCLG of £77.1 million to contribute to the project. That was going to be housing infrastructure funding, but due to changes in government's decision making on this, we were unsuccessful in gaining the award of housing infrastructure funding direct to the council, and the major contribution to the infrastructure was awarded directly to Homes England and Network Rail as key landowners on the site. Other major elements of the funding are contributions from both of the regional local enterprise partnerships, with North Yorkshire contributing £3.1 million and the West Yorkshire Transport Fund contributing £23.5 million towards the delivery of the enabling highways infrastructure. Another large element of the funding will come through the enterprise zone status of the site, where as part of our work with the North Yorkshire LEP, we have the capacity to borrow £35 million to be repaid from the retained business rates on the site when the commercial elements of the scheme are developed out. And then that there is then a balancing contribution towards the infrastructure from the landowners of £11.6 million, with the council contributing the balance of its own £10 million allocation to the project of £4.6 million to contribute towards that infrastructure. So as you can see from that, the council is very much one of the smallest contributors of direct funding, and through its work with the LEP on the enterprise zone, has a role of channeling external funding into the site. So as an update of what has happened over the last year to change the situation regarding governance, some things remain the same in that CYC remain a minority landowner and we will not be the ones developing out the scheme. But there's been a major change in that funding expectation of the funding going now directly to Homes England and not CYC. And that results in an increased risk to the council regarding the delivery of the infrastructure if we were to continue to be the lead partner for the delivery of that. CYC in that situation would effectively sit between the funding bodies and the landowners, which would require some fairly complex funding agreements to be devised, and would expose the council to the risk of cost inflation on that 155 million. So that's not a decision to be taken lightly. And then given the majority of that for the funding for the infrastructure package 1 infrastructure package 2 is going to Homes England, WICA themselves require some certainty and some guarantees over how the infrastructure is going to be delivered and who that funding is to, and what grant conditions are signed up to by the delivery agents to underwrite the West Yorkshire Transport Fund contribution. So that has led us to have to reconsider some of the kind of key questions here on who is delivering the infrastructure and how does that governance need to change to reflect a rather different starting position from that reported in early last year. And we're drafting a report which will come to executive when all those options have been outlined sometime in the spring. So just to remind you that CYC to date has contributed of the £10 million that it allocated back in 2012, it's allocated at the moment about £6 million of that, and we expect some of that to be repaid as the part of the contribution to the enabling works and the planning on the reserve matters to get the infrastructure in, coming from that £77.1 million grant from MHCLG. and we'll be bringing back a future decision regarding the allocation of the remaining monies from the CYC capital contribution, and also the larger portion of the enterprise zone monies and the borrowing to undertake that. Those are decisions, just to remind you, that have not yet taken place. So in considering what the governance arrangements need to look like in a slightly amended world, in the report I've set out two different alternatives about how this might work, and we're just going to talk you through them because they're a little bit on the complicated side. So the first of these diagrams reflects the picture should CYC continue in the role of the delivery agent for the core infrastructure for the work packages 1 and 2. On the left-hand side, in the orange boxes, to match my camera angles, you have all of the different funders contributing towards the project. So we've got the LEP, we've got the enterprise zone, we've got WICA separated into two elements. For the first for the infrastructure to the rear of the station, and the second for the actual western entrance to the station, and then the MHCLG funding and our own capital contribution. In the middle, you have the different parties who are going to contract with each other for the delivery of that infrastructure. So we have CYC contributing its own funding, but also as the conduit for the LEP funding and the West Yorkshire Combined Authority funding and future enterprise zone funding, but with the MHCLG money going directly to Homes England. This would require, therefore, a funding agreement between Homes England and CYC for all of the works involved in IP1 and IP2, which is somewhere in the region of about £70 million worth. We would also need a separate arrangement for us to then further contract for the delivery of future work infrastructure packages 3 through 7, which are over here on the right-hand side, which we would be commissioned by the landowning partners to deliver. On the right-hand side of the diagram, you have the commercial contracts for delivery for the infrastructure work packages, the first of which is for the enabling works to John Sisk Limited, and that is a direct award by the council to do the preparatory works which were agreed in the July executive report. And those are overseen by the York Central Infrastructure Delivery Board, which is chaired by the council. And they oversee the delivery of that work package. If the council would continue in that role, then there would be a further contract with Sisk for IP2, which would need to go through the same arrangements, but would need to be all of the commitments in that would need to be backed off to Homes England, who are in receipt of the majority of the funding for that. So you can see that ends up being quite a complicated way of commissioning those works on IP2. The green blobs that you see on this diagram, I'm going to come on to a revised governance solution, but that reflects the different boards that will be overseeing the different levels of activity. So on the top there, you've got the Infrastructure Delivery Board delivering on the actual works packages. You've got the Delivery Coordination Board on the right-hand side, coordinating the activity between on the overall programme and having that oversight on programme cost, the different interfaces between work packages, the different contracts, and the communications and engagement. On the bottom of the diagram in the red box, you have CYC in its role as a regulator in both its roles as a planning authority and a highways authority. And that brings with it slightly different contractual arrangements between the council as regulator and the landowners as developers. So in this particular instance, where we're delivering the core infrastructure, there is still the need for a direct contract between landowners and CYC planning for the Section 106 contributions for the site. If, however, we follow the second option, which is for Homes England to take over responsibility for future work packages for infrastructure delivery from the council and be directly contracting with Sisk to deliver IP2, and then with then separately procuring further work packages, perhaps with Sisk, perhaps elsewhere. There's a different set of arrangements come into play. Firstly, the MHCLG funding is a direct pass-through from Homes England through to CISC for the payment of IP2 works, so that doesn't need to be contracted for between Homes England and CYC. West Yorkshire Combined Authority want to have a kind of back-to-back agreement for their funding, so that they have got a really clear line of accountability for their funding through to the body who are delivering it. And if that ends up being Homes England, then it is under discussion about whether or not that WICA funding agreement would need to be directly with Homes England rather than with CYC. The LEP funding, however, still comes through CYC, as does our own capital contribution, and therefore the contractual arrangements between CYC and the landowning bodies would need to cover that early work on IP1, the arrangements around the Millennium Green Trust, which is a direct contract between us and the Millennium Green Trust, and then the future decisions on the enterprise zone funding and CYC funding. Similar assortment of different bodies overseeing that work. So if that second option, which is the most likely based on the discussions that have already been had with partners in terms of the desires of the landowning partners to be able to contract directly for the delivery of the core of the infrastructure on their site. This is the potential future governance arrangement that's currently being worked upon. So what we've tried to do is to maintain at least the kind of shape of the different governance bodies in pretty much the same format, so that we don't have to go back and do another partnering agreement between the York Central partners, but that the form and function of some of these bodies would need to change to reflect slight shifts in delivery roles and the relationships between the partners. So we still have a York Central Strategic Board at that very highest level, and I'll come on each of these boards to explain a little bit about what they do. It's supported by the Delivery Coordination Board, but a very significant change is the role of this blue box, the York Central Landowners Board, which is the 95% land ownership from Network Rail and Homes England, controlling the decisions around the development of the site and on the delivery of the infrastructure. Because we now have at the Strategic Board a number of external partners sitting at the table, including Make It York, the University of York, the Civic Trust, as well as funders. The purpose, the role of acting as an escalation board needs to be kind of split out from that and dealt with in a group of a subset of that group that is partners only, so that if the coordination board has any issues that cannot be resolved at that level, there is a higher route through to sorting out any residual issues. We have the executive on this diagram in a really key position from the council's perspective of making all of the decisions, because the people who are sitting at the strategic board and the coordination board are not empowered to be able to make decisions on major kind of financial commitments. Those still are within the purview of the executive, and therefore and also come under the purview of the Corporate Scrutiny Management Committee. Over on the right hand side here we have a design panel, which is a non-decision making advisory board that will advise the partnership and the strategic board on the design issues related to future design proposals coming out of the scheme. And then on the bottom we've got the same workstream boards, but we also have the Science Museums group making their own decisions on elements that relate to the NRM master plan and feeding into the escalation board. I'm just going to take you very quickly through each of these different functions. The strategic board has, as I said, senior representation from all the partners at the highest levels, from the leader and the chief operating officer from the council, through to Peter Freeman, the new chair of Homes England, Sir Peter Hendy, chair of Network Rail, and Dame Mary Archer, the chair of Science Museums Group, supported by senior staff throughout that. It also includes senior representatives of our city partners in the person of Greg Dyke as chair of Make It York, who's the new chair of the board for 2021. Charlie Jeffrey, Vice-Chancellor of the University of York, Andrew Morrison, Chief Executive of the Civic Trust, and then representatives of the York North Yorks LEP at chair level and Leeds City Region at chair level, meeting quarterly, and the function being largely around influence and advocacy and promoting the scheme at the very highest levels, nationally and internationally, acting as ambassadors for the scheme and providing the oversight to provide assurance to the city and to all the bodies involved that the scheme is delivering the ambition and the quality for the city. The executive's role remains as the major decision maker for all CYC questions, and that will include going forwards all decisions regarding CYC funding going into the scheme, and that's partly our own capital funding, but also importantly deciding with York North Yorkshire LEP on the allocation of enterprise zone funding towards the scheme. And just as a reminder, that enterprise zone funding has been awarded on the basis that it assists with the delivery of the infrastructure. So the first 35 million of any business rates that are retained in the city have been agreed by full council to be allocated to the project. The executive are also responsible for overseeing CYC's risks within the project and the delivery against the programme where it impacts upon those risks and the costs faced by the council. We also have a role in considering our future support for contributory work streams for the project, including a scheme that is under consideration at the moment through the delivery of CYC housing as part of our housing delivery programme, and in involving ourselves in the development of other community facilities and community schemes on the site. Working with landowners to achieve the outcomes for the city and ensuring that the partnership continues to undertake the high level of community engagement that it has committed to since the beginning of the project. The coordination board is the kind of engine room of the governance arrangements that are responsible for overseeing the delivery of the scheme benefits that have been identified, overseeing the different interlinked dependencies and the programme timetable that arises from all of those dependent pieces of work, identifying and escalating decisions for each partner body to get decided upon and bring back to the project, and overseeing risk at a programme level, managing the interrelated funding agreements, and working together to develop future strategies for delivery to make sure the scheme delivers on its promise. As I've referred to earlier, the escalation board has been carved out from that strategic board to be able to provide that escalation role if the delivery coordination board cannot resolve any issues. The York Central Infrastructure Delivery Board, which currently exists, will oversee the delivery of that first work package and managing both timetable, risk and budget for that, and then to consider any future addition to that scope should the landowning partners to the project decide that they want to commission that through City of York Council. Which then leaves us with two or three other boards, and I'm going to invite Stephen to talk to the committee about the landowners board and the design panel, and then ask Catherine to talk about the governance arrangements set in within the NRM Master Plan Project Board.
Thank you, Tracy. Stephen Hind, I'm Head of Business Development for the Eastern Region of Network Rail. I'm also Network Rail's representative on the Landowners Board and also on the Delivery Coordination Board. So I think the project is a fantastic opportunity for the city, and I believe it should offer an exciting opportunity for new jobs, stimulating the economy and creating new homes. On the Landowners Board, the Landowners Board is Network Rail and Homes England. We work closely together as two public sector organisations. We have a collaboration agreement between ourselves, and that will manage our risks and opportunities as the project progresses. Things have changed, so the funding of the project has changed. Originally with a housing infrastructure grant, the funding would have gone straight to the City of York Council. We're now in a position where it will be going to the landowners, and it's up to ourselves and Homes England how we manage that governance between ourselves, but how we also work in partnership with City of York Council the National Railway Museum to really push this project forward and make the most of it. This is a once in a lifetime opportunity for York and the city that we're all passionate about. The Landowners Board, very much, we will go into our own organisations and make decisions and ratify decisions, which then will be collectively managed through the Landowners Board. But we also will represent those views back into the York Central Delivery Coordination Board. So there's nothing that we're quite open, we're quite honest. We talk to our partners about what the fundamental reasons behind the decisions that we're making, but it's really about us managing the project and really starting to move with it. We're looking at how we deliver the infrastructure. We've got John Sisk, we're managing it if that could be novated into the partnership. We're also looking at how we would manage out the plots, both on the commercial and the residential sector. So that is really where we are on the delivery coordination, on the Landowners Board. In relation to the design panel, we committed to first class, high quality design, and something that came out of the strategic board was an ask to look at a design panel. We've been working at who could chair that panel, and we've had some strong architects on the original master plan that will be very well placed to take that forward, and we will take certain of the key decisions in front of that panel as and when we get to that exciting stage. At that point, I'll hand over to Catherine, who can talk a little bit about the National Railway Museum's exciting plans also.
Thank you, Stephen. So, yes, I represent the Railway Museum on the Delivery Coordination Board. And I have to say that the plans we have for the museum are a little bit separate. We are raising our funds to transform the museum. And our goal is that by 2025, we will have a stunning attraction that really is inclusive. So it's open for all. And for the first time, we will be able to unite the two halves of the museum. Now, the funding there is being raised by the Science Museum Group. But we are working together with our partners, so with the council and with Network Rail and with Homes England, to make sure that we can realise this ambition, because at the moment it's a brownfield site. This part of York is not attractive, but we are working together to get this to be a truly successful economic and housing area for York. So we have our own master plans going on. We are planning to develop the museum that we currently have, create a new building as well that connects the site. And we're working all the time with our partners to make sure that our plans and our building and our demolition is all in line. We have to make sure it comes together. 2025 will be the 200th anniversary of the Stockton-Darlington Railway, as well as being the 50th anniversary of the Railway Museum. So for us, it's a really key date that we're striving to achieve. And we are just all working together to realise these strategic objectives for York Central.
Thanks so much, Catherine. And then just finally, just as one adjunct to our governance arrangements around the partnership, let's just not forget our the statutory authorities that we have within this as planning authority, deciding on all future reserve matters applications for the remainder of the infrastructure and the public realm, any housing schemes, any commercial schemes, overseeing the contribution of the Section 106 funding and commitments from the landowners, and obviously then enforcement of the planning permissions on the site. As Highways Authority, we have the agreement of the Section 278 legal agreement, which is around the permanent alterations or improvements to the public highway as part of the planning approval. Section 38 agreements around road adoption once that infrastructure is delivered, and then any subsequent improvements to the Riverside Path, which we are also continuing to work on. Those sit outside the governance of the project, but I think they are important just as context for the committee to understand how the council applies its all of its different roles in relationship to York Central. So I'm going to stop sharing my screen now and open up for questions.
Thank you very much, everybody. Members, if you could just indicate with your blue hand if you have any questions, just while I'm watching the hands go up. Tracy, could I just, Tracy or Neil, just in your presentation, just as a point of clarity, you said quite early on that from the 77 million that was going to the joint venture that you expected some of the money to be repaid from that 6 million. And I'd understood that from previous discussions that all of that, I think it was 5.4 or 5.6 million, I'd understood that all of that was due to come back to the council. Could you just clarify what the expectation is?
Yeah, the funding to be returned is the funding that has been contributed towards the enabling infrastructure. So if it was part of the £155 million that the MHCLG funding was given to contribute to, then we expect to get that back. We're currently under discussion about exactly the fine detail of that, but we expect those discussions to conclude in the next few weeks.
So just for clarity, there's been those two payments that have been agreed by executive. I think one was 2.8 million, one was 2.6 or something. I'm slightly plucking figures out the air, but I think the total was about 5.4, 5.5 million. Are we expecting only some of that 5.56 million to come back to us, or are we expecting that it's all of that amount that would come back?
No, it's not all of that, because some of that was the early works on putting together the outline planning application, which were not covered by the MHCLG grant. They were kind of speculatively upfront. They were part of the 10 million that the council put towards a scheme to enable it to happen.
Yes, and I think that was from an earlier decision. So I'd thought that there was these two payments that had been put forward as kind of, advance payments while we were waiting for the 77 million to come forward, whether it was through HIF or some other means. And I'd understood that to total around about 5.5 million.
No, the first of those was to keep working on the outline planning application. The second, which was as part of the July decision, is a constituent part of the £155 million of infrastructure funding, and the elements of that will be charged back to Homes England as part of the MHCLG grant. The complication in that is that some of that is also being picked up by North Yorkshire LEP as part of their grant funding towards the project.
So sorry to be a stickler and keep pushing on this then. So that 2.6 million or whereabouts it was exactly that was agreed in July, not all of that may be returned to the council.
The bit of that that is not being funded by the LEP will be returned to the council. So the council will not be picking up that sum as part of its contribution.
But
all the money the council effectively said that it would get refunded in the July report will get refunded to the council, unless the council hasn't spent the money and we've used LEP money, for example. So the council has been kept whole in a report, I think is the nub of what you're asking.
Apologies, Neil. For me, it just at the critical moment there either froze or what
it's been doing that all day.
Yeah.
Yeah. The council is being kept whole in terms of all the money that it is spending in respect to the July report. Some of the funding that we talked about in July has been provided for the LEP, so we can't get refunded for money that we've not spent. It's been given as grant effectively by the LEP.
Okay, I think we'll maybe return and just dig into the finer points of that perhaps on email, because I don't want to labour it too much this evening. I'm going to take everybody's hands as they've gone up in order then. So Councillor Fenton.
Thank you, Chair, and thank you, Tracy. I think that was very helpful and very colourful exposition of the rather complicated, but I guess necessarily complicated governance structure. On one of the earlier slides, you made reference to some risks for the council arising from the government's chosen method of putting in the funding. I just wanted to be clear that would those risks be mitigated by a change of approach in terms of infrastructure delivery? So if the responsibility for, I think it was IP2 and any subsequent infrastructure packages, if those were to be taken on by Homes England and Network Rail, would that address those risks to the council that you identified on one of the early slides? I just wanted to make sure I'd understood that correctly.
Yeah, that's correct, Councillor Fenton. When we expected to be the body in receipt of the large portion of the funding, there was and also the authority who were going to adopt the road, there was an inherent logic in us being the ones who built the road with money which we were in receipt of, and then adopted it. When we are no longer in receipt of the vast majority of that money through the MHCLG funding switch, that poses a very different risk profile to the council as being the kind of jam in the sandwich, really, of neither not being in receipt of the funding monies, and therefore having to contract with the landowners to be able to build them a road, which they then hand back to us. It is legally incredibly complex to be able to do that, and it presents us with some kind of difficult questions about if the costs increase, if there's a cost overrun, if there's a delay, who picks up the tab for that, and it puts us in a situation of having to kind of either contractually manage that or practically manage that, when it's actually not our risk, it's not our money, it's not our site. So that has led to a rethink on everybody's part about who is best placed to be able to deliver the infrastructure. And the proposal, which is currently under consideration, is that the landowner partners who are in receipt of the money and who own the land are the ones who will contract to deliver the road, and then we will step into our role as Statutory Highways Authority and adopt the road at the end of that process. If you want to add anything to that, Neil.
No, I think really it's probably Stephen who's best placed to pick up your view as landowners and funders, Stephen.
Yeah, I think Tracy and Neil, you both summed it up very well. When the project was a housing infrastructure fund, and the funding would have gone straight to City of York Council, it was the obvious choice that City of York Council led the delivery of that scheme and project managed it. I think now we're in a position where the funds have come straight to the partnership. There is a logic that we take over delivery, so we manage the contracts and we manage those interfaces with the wider development. We will be taking the delivery risk associated with those with that work, both in a cost and a program perspective. So it seems more logical that we step forward and look at the opportunity of delivering it ourselves. And when I say ourselves, I refer to the partnership of Network Rail and Homes England and how we manage that going forward.
If I might add to that from a landowner's perspective and CYC perspective, because Stephen and the team will be effectively bringing forward the interfaces between infrastructure and plots can be better managed by a single landowner partnership, so that effectively the speed of development on individual pieces of infrastructure can be influenced by potential purchasers of plots or developers of plots as the landowners and effectively infrastructure delivery partners see fit. And we wouldn't have had, if CYC was just delivering the highway, we'd have constantly been referring back to the landowners as to interfaces with plots, their potential sales, potential developers. So it makes it, I think, for the city's perspective, not just the partner's perspective, a more coherent approach to this infrastructure delivery.
I think it's also fair to say at that same point, Neil, we have appointed a project director and a team underneath that project director for this very purpose. So that team is established. It's working very closely with Neil and Tracy and Catherine on how the wider development is taken forward. So it is if we decide to go down this avenue of delivery, we have the project team already appointed that will lead that development.
And just for complete clarity, because I think it is a complicated structure and we're sort of using terms interchangeably. So there is the York Central Partnership, which is the partnership of City of York Council, Network Rail, Homes England and National Railway Museum. And then there's the joint venture partnership, which is Network Rail and Homes England. And it's that partnership that's received the 77 million funding. And I presume that the project director that you're talking about and the team is part of that joint venture partnership between Network Rail and Homes England.
That's correct.
It is, yes.
Yeah, it's just when we're talking about different partnerships, it all sort of starts to merge into one of it, doesn't it?
If you refer to the
so I'm just gonna,
yeah.
So just going through the questions in the order that they've come up. Councillor Kilbane was next.
Oh, thanks, Chair, and thanks, Stephen, Catherine, and Tracy for your presentations. It's following on from that, really. I'm just wondering if Stephen, if you can shed any light on why the MHCLG switched the funding from the council to the partnership, the 77 million.
I'm afraid all I can do is saying we pushed very hard to get that funding released, and it was something that the City of York Council and the leader of the council and all our organisations fought very hard for. It was a competition. Certain housing infrastructure schemes were taken forward. We were influential in that decision. All I can say is we're very thankful that we've got the 77 million through MHCLG, which allows us to deliver the scheme. I'm not privy to the politics of what caused that changing tactic.
Councillor Kilbane, perhaps I can come in and say that on all of the decision making around the housing infrastructure funds were based on the government's existing Green Book assessment of viability, and that related to the uplift in land value from the infrastructure investment, which strongly favoured southern authorities and didn't actually result in very much being spent anywhere north of Watford. The government have now indicated their intention to review as part of their levelling up commitments to how some of those ways of calculating investment actually work. That's why we were unsuccessful on HIF. I think I agree with Stephen, we can't really kind of comment on the political considerations as to why they decided to switch that out and turn it into a form of funding for which we had not applied, but we can only be grateful that we actually were successful in one way rather than none.
Thank you. Councillor Pearson was next.
Thank you, Chair. Thanks, Tracy, Catherine and Stephen, for your presentations. I'm just wondering, obviously, we've got this quite complicated, necessarily complicated arrangement set up, and I'm just wondering, realistically, what other options are there in terms of governance arrangements or to actually increase the City of York Council's leverage on this scheme?
I mean, I can address that question in terms of the options that we've got under consideration at the moment. I think we either put ourselves in a position where we've got maybe a little bit more skin in the game, but we carry with it a heap more risk, which is the two options that have been outlined. I don't see any other options that we've got other than kind of kiboshing the entire scheme by making it so difficult it doesn't happen. It's still not over the line. We still need to make sure that this very difficult and complex funding package that we've put together over the last few years remains intact and that we've got good progress being made. I think the biggest element that the council can concentrate on in terms of how it has influence is the future decisions around its own capital contributions to the scheme and the enterprise zone funding. Those are decisions yet to come to executive for sign off. You know, the principle has been agreed, but the actual decision to allocate funding has not yet been made. And the asks from the council of the landowning partners about what we might want in return for the allocation of that funding, I think, is our core element of influence now. Our decisions will be difficult because that's not control. That is we don't own 95% of the land on that site, and therefore we cannot be the ones in the driving seat, and never intended to. Let's just remember where we entered into this. We entered into this putting 10 million towards the scheme to make it happen for the city, and that still remains where we are today. We're not landowners, we're not the developers. And we are the facilitators, and we stay very firmly in that seat to try and make this happen for the city and make it happen and deliver on the outcomes for the city as positively as we can.
Thanks, Tracy. Just building on the point that Councillor Pearson's raised there, I just wondered, Stephen, if you could just give us any thoughts on, because my sense of this is that as the 95% landowners, that landowners board is really where a lot of the power sits, I suppose, and certainly if you're the purse string holder with that 77 million and all of that, what sort of local influence is there at that level on that board? Because I guess as Network Rail and as Homes England, you're nominally, whilst your public sector bodies, you're kind of national bodies. Is there any sort of room for a local voice on that board within that part of the structure?
So the landowners board is essentially what it is. It is a landowners board made up between Network Rail and Homes England. We're taking the commercial risk now of that, and we've put the predominant amount of land in there to take the development forward. I think you go back to why we're doing it. I think purely if it was about a profit scheme, we would go elsewhere. There isn't a large amount of profit to be made out of this scheme. We're here because it's a brownfield, underdeveloped site, and we want to give something back to the city. We believe it's one of the most influential pieces of land in the country adjacent to a station. And we're all at the Network Rail and transport is about connecting people to places, to jobs, and that's exactly what this site is. So we will manage it. I'm from York. I'm passionate about doing something for the city and pushing this development forward. And we will push it for the good of the city. My chairman, Sir Peter Hendy, regularly comes to York, and he's also passionate. He sits as a trustee of the National Railway Museum and the NMSI also. So also is quite influential and passionate about this area of the city. So I think there's two things. It will always be the landowners board, and we it's about us making our decisions about the commerciality and the deliverability of the scheme. What we will be is we'll be open and honest with the delivery coordination board and our partners about how we take the steps forward in order to deliver the scheme.
I also just underline the role of the strategic board in keeping the landowning board keen, because the level of representation on that board is quite significant, and the commitment, I think, and the interrelationship between local and national that we have at that board, I think, is a good counterbalance to the commercial interests which are quite rightly controlled by the landowning board.
Just add.
And Neil, did you want to? Yeah.
Yeah, just to add for the committee's perspective. Obviously, the local plan consists of nearly houses across the whole city. We have more influence on this site than any of those other 18,000 houses that are going to be delivered. So we don't sit and have influence on Persimmon's board, Barrett's board, Wilson Homes board, and they're in the similar circumstances where landowners are sites and putting public infrastructure on it. So I think we just reflecting on the influence that we do have over and above what would be normal on a development site on this site is that strategic board that Tracy's talked about, the influence in terms of the 35 million of enterprise zone money albeit a constrained influence, and the wraparound that you've put in place already as members with the design guide through the outline planning application board, and obviously those further iterations of detailed planning applications as they come through on a site-by-site basis.
I appreciate that. I think that the difference between, say, Persimmon or any of the other developers that you mentioned is because this site is so unique and so important, and I fully agree with all the points that Stephen made about the you know, the nature of the site, but there is also that element of the need to deliver both commercial as well as residential on the site, and given that the council's risk is in a way, it's so important that the commercial is developed to its full potential, not just for jobs creation, but also that we get our £35 million repaid over you know, the course of time. And I'm just slightly nervous that in a way I'm not clear as to how we could prevent the landowners board from choosing to solely develop out the residential, because that's lower risk and higher yield at the moment, and actually kind of leave us in a slightly vulnerable position.
They'd have to choose not to draw down the £35 million enterprise zone.
Well, there's many facets to that, aren't there? There's an outline planning application which absolutely defines what's going to go on the site, and it is a mixed use site. The MHCLG funding was on the basis of the HIF application, even though it's not HIF money, and therefore it's based on a mixed use site with commercial as well as residential. And as Neil says, there's the fact that there would be a major gap in enterprise zone funding, because you wouldn't be giving us the certainty to be able to borrow on the basis of drawn down business rates. But we also then fall back into our planning regulatory role of there is an outline plan application which expects that to happen. It is not for a housing only site.
I just add on the enterprise zone. The reason I started on that mentioning it is that the enterprise zone is directly awarded to the local LEP and CYC and from Treasury, and it's just worthwhile reflecting that Stephen's organisation, Homes England's organisation, when we come to the seniority in departments, it's the Treasury. If they started to make decisions contrary to this, I'm sure there'd be some very quick telephone calls made within departments as to the validity of any decisions being made. So it is worthwhile reflecting that enterprise zone has Treasury backing.
Yeah, and a significant interest in a government hub on the site, which is also a demand for commercial space coming out of government.
I think for us in a pre-COVID world, we were one of the organisations that were running out of office space in the city, and really looking forward to an opportunity to get to better quality office space for both ourselves and our supply chain. But we have signed up to a Section 106 agreement. We've got an outline planning application and now a reserved matters application. We are committed to delivering a mixed use development on this site, and linking it to the station, and really improving the station offer also.
Thank you. So Councillor Hunter was next.
Thank you, Chair. Thank you for a very full and interesting presentation. I don't know about anybody else, but my head's a complete shed tonight. How you guys work on this day after day, I do not know. But I think this is possibly a simple question. Could you just please outline your up and coming decisions and the next key steps regarding York Central?
Yes, so the next decisions that will come before executive will be decisions around change governance arrangements and around different roles for the infrastructure delivery. So when we get clarity about what those are going to be, there'll be proposals coming to executive for those to be signed off. The next significant decisions for executive will be around the allocation of further funding for future infrastructure packages, which will be off the back of proposals from the landowning partners about who and how they're going to deliver IP packages 3 through to 7. And then the landowning partners will be bringing further planning applications through to our planning committee for further phases of infrastructure, but also then development packages as part of the early phase commercial and the early phase housing. And that's maybe something that Stephen can talk about. But Catherine may also want to speak about future planning applications for the NRM, which will be another set of planning decisions coming forwards.
Okay.
Looking at Stephen or Catherine, if you wanted to add anything to either of those points.
For ourselves, we've got the diversion of Lehman Road, which is a key part of the scheme, which also links into Catherine's NRM scheme. For us, appointing a contractor, agreeing that the final costs with that contractor and the programme are really key issues for us, and really getting on as soon as we can into that delivery phase. So that's where myself and my colleagues in Homes England and our project director are spending most of our time at the moment.
Thanks.
Yeah, the only thing I would add is that what Stephen's just said there is that this has been described as giving hope after a horrendous year of COVID. So, you know, all of us need to keep looking to this future state where we've developed this part of York and made it absolutely beautiful for everybody's use. So I think it's, you know, it's really exciting. It's hard work. There's a lot going on. And I just think, you know, let's keep focused on the positives.
Yeah, thank you.
Thank you. Councillor Kilbane.
Oh, thanks, Chair. I've got an eye on the time as well, so I'll be quick. And actually, some of the questions that I had to ask have already been answered. Just for Stephen's benefit, one of the reasons we're so concerned about it all becoming residential is it's exactly what happened in a large part of our ward with the old Terry site, which you'll be familiar with, where the outline planning was for mixed use, and it was for jobs, and it was for community facilities, and there are absolutely none of those things there now, except for residential. So that's why we've been focusing on that a bit tonight, I guess, and that's where our concerns lie. In terms of the questions, in terms of the governance arrangements, and this is for anybody to answer really, a couple of questions. How can we ensure that the community involvement that we saw at the start of this project with the My York Central, how can we ensure that that carries on through it? And the other part of the question is, how do we ensure that through all the stages, the development can be used for training and development of high quality, high paid local jobs?
I think this is probably a good question for Stephen to talk about how the partnership intend to take forwards the model of community engagement that we have championed to this point. The council will continue to do its work on My York Central and to promote that as a way of doing business. I think pass over to Stephen to talk about how the landowning partners intend to embed that within their approach, but both the commitment to that and to embedding skills development, apprenticeships and training and local SME growth in the delivery phases as well as the end product, we're all can refer to in the partnering agreement and are all key tenets of our partnering approach that we're taking. And we have an expectation that as the infrastructure delivery hands over from the council to the landowning partners, that they continue with that commitment. So I can invite Stephen to talk about that one.
Unmute myself. Thanks, Tracy. So there's two questions there. High quality jobs, I think that's about us working very, very closely with the City Council and working out and really also the senior board that we've got about what we attract and how we attract high quality jobs. We've got the advent of a potential government department, which may help. I think it hasn't been forgotten, we are one of the major employers of the city. We have a need for high quality people to join our organisation. And we've got a large control centre. We've also got a large number of engineering and asset management jobs within the city. And we know we have an ageing population within the rail sector. So for something for ourselves, we're keen to make it as an attractive proposition as we can. In relation to community engagement, I think any job that we do, we've got to liaise with the communities and explain what we're doing and why we're doing. And we're just going through the process of appointing some specialists to help us with that piece of work. as it transitions over to the landowners. So you will see an increased presence or an increased amount of engagement in the coming months. I think it's fair to say we've struggled, and it's been a challenge in the COVID environment to get out and have those drop-in centres, which we did prior to the outline application. But it's something, as and when we bring our contractors on board to deliver the infrastructure, that we will be working with the contractors to explain to the community what we're doing and how we're going to do it as sustainably as possible. And then there is also something about, on a plot by plot basis, explaining what we're doing, what our plans are, and why we're developing the plots we are in the sequence we are. So yes, there is a commitment from the partnership to do that.
Thank you very much. I'm looking around and I'm not seeing any more blue hands going up. I'm wondering whether perhaps everybody's desperate to hear what our dear leader has to say at 8 o'clock. So we're only a few minutes away from there. So unless anybody else has anything burning, I think it just leaves me to say thank you very much to Neil and Tracy, but particularly to Catherine and Stephen for joining us this evening. I think that has been really helpful. It is obviously it's quite a complex arrangement, and it's really helpful to have it all set out there, and I'm sure it'll be something that we'll want to return to again in the future. So you're all now free to leave the virtual table. As I say, thanks again for your time this evening. And then committee members, if I just move us very, very quickly on to the final agenda items. We have agenda item 6, which is just looking ahead to the work plan. I'm not going to take us through it in any detail unless anybody has anything that they wanted to raise. I just wanted to note that we have had a call-in on the decision around Make It York. So that's penciled in for the 25th of January. Which was our call-in slot that we had empty. So committee members will need to be available for that if you can, or arrange a substitute. And also to say that we had penciled in, and then council confirmed the wish to have this joint meeting of Economy in Place and Children Education and Communities, looking at apprenticeships. And so we're looking at that for the 1st of February as a commission slot for that. And so then just bringing us on to our next meeting coming up on the 8th of February for this committee, CSMC. I'm anticipating that we'd have another public health update similar to what we've had this evening. It's obviously a very fast moving picture. We've got the annual complaints feedback, which came from Audit and Governance, and is for us to have a look at. And then I will be confirming with Stephen as Vice Chair whether or not we want to add anything else to that agenda in the next day or two. So we'll update you on that as soon as we can. And last month I did mention about day one absence contract renewals. And I had a conversation with Trudy Forster, who said it would be helpful for that to come to this committee, but that timing wise it would be best if that came in April. So I've penciled that in for April. But we'll be building that picture a little bit more, stretching out into the year. That's my plan over the next week or two, to have a longer term look at what our agendas will be going forward. I don't have any urgent business, so unless anybody wanted to raise anything else. Councillor Kilbane, your hand's jumped up.
Just my little joke, Chair. I wanted to see all your faces.
Well, on that lovely note, thank you very much, everybody, for your input this evening, and let's all go and see what the Prime Minister has to say.
Live stream's now ended.